Hi, my name is Misha Syed, and I am an ophthalmologist and practicing glaucoma specialist at the University of Texas Medical Branch in Galveston, Texas. And I have been in this position since 2006 when I had finished my Glaucoma Fellowship with Dr. Feldman and Dr. Bell at University of Texas Houston. And I am very appreciative of the time I had there in my fellowship and what I learned. It was great to have so much hands-on experience, which I think was a real plus for my training. I was given the autonomy to do cases as primary surgeon for trabs and tubes and phacos combined with those procedures and alone. So I felt like I could really hit the ground running when I joined as faculty at UTMB. And I was the only glaucoma specialist when I joined here, so I really did have to hit the ground running, and I had a lot of surgeries right off the bat and was pretty busy clinically. So I really feel like the fellowship at UT Houston prepared me really well for that.
Hello, my name is Dr. Carlos Vives Alvarado. I'm currently a glaucoma specialist working here in private practice in the island of Puerto Rico. Right now, I'm seeing about half and half general ophthalmology and glaucoma. I finished my fellowship at Houston just this year in June 2020, and before that I had done my ophthalmology residency in Puerto Rico. So going back to the island after finishing my fellowship, I can tell you that being at Houston with Dr. Feldman and previously with Dr. Nick Bell, it was awesome. They gave me the tools needed to see all the patients and all of the pathology that I'm seeing down here in the island, the whole range of the glaucoma diseases. It was an excellent year. Obviously, we had the virus come in at the end of the fellowship, but before that, it was awesome. The surgical volume was great, and the different pathologies were awesome also. So I think this fellowship definitely gave me the tools to feel confident seeing patients on my own and taking the decisions to treat the patients clinically and surgically. So definitely an excellent place to be, Houston, an excellent city to be. If any other questions, don't hesitate to ask.
Hello, my name is Jeannie Ling. I'm an ophthalmologist and glaucoma specialist at Kelsey-Seybold Clinic in Houston, Texas. This is my third year in practice. I did a fellowship training at UT Houston, and it taught me well about clinical judgment as well as solid surgical skills, including trabeculectomy, tube shunt, and various mixed procedures. I think the fellowship program was my favorite year in training because in addition to being very educational, it was also very friendly and supportive. I highly recommend.
Hi there, my name is Hector Villarrubia. I completed my fellowship in glaucoma at UT Texas Houston with Dr. Feldman in 2006 to 2007. Ever since then, I've been in a private practice. I currently own a group practice called Caribbean Glaucoma Consultants in Puerto Rico. I do also teach in the different med schools in Puerto Rico and the ophthalmology program. I have an associate professor nomination in one of the med schools. So far, so good. Things that I want to say about the fellowship and how it helped me. First of all, you're gonna be under the wing of Dr. Feldman. When I say that, I mean it literally. Not only on the clinical skills, the surgical level, he's gonna take you places to meet the right people. So people get to know you, important people in the academic world. So the fellowship is gonna provide you with the tools to do whatever you think is best for your life, either private practice, group practice, academic career. It all depends on you. He's gonna make sure that you are gonna be able to publish at least 1 or 2 papers. He's gonna make sure that you are able to present at the American Glaucoma Society meeting. Those 2 things were really life-changing for me, especially presenting at the American Glaucoma Society meeting. That made possible for me to know key figures, which I still know on a first-name basis today, and I can give them a call and they can help me if I'm stuck in a really tough case. And they also help me when my patients go and live abroad and need follow-up with other people. Other thing that I can say about the program, it's going to allow you time to grow both professionally and personally. Right out of the fellowship, I was able to take my boards and become a board-certified ophthalmologist right out of the first take of the exam. I recently recertified in 2018. Overall, I can say I'm really happy. The fellowship made a big difference in my life. I probably owe most of my success to that fellowship. I'm a former president of the Puerto Rico Glaucoma Society and a former president of the Puerto Rico Ophthalmology Society. The best of luck to all of you. Bye-bye.